through our community of dental education and health. The journey so far, the Nigerian Association of Dental Students currently has a secretariat at Obafemi Awolowo University, Ile-Ife in Osun State, of which I'm a proud student of Great Ife. Okay, so the secretariat we took over in June this year, and of course, due to changing times and seasons, we had to decentralize, and we also have to incorporate all other dental schools. Back then, the secretariat is usually concentrated in a particular school, but now we had to decentralize to cater for more and more upcoming dental schools. So first of all, when we took over this administration, we started up with relaunching our community on dental education and health through a new logo. We also went ahead to launch a quarterly newsletter named The Floss, which is released by the editorial team. So we have gone on several community outreaches as an organization, even in our local chapters all over Nigeria. Also, part of the symposiums we've had, we started with the Doctor Story, which we had the second edition we had the second edition last year, where we were gracefully honored with the presence of Professor Akintade, who is the provost of the College of Medicine Bayes University, Abuja. We also went ahead on November 20 with Cancrum Oris campaign, NOMA, which is a debilitating disease, which is a neglected tropical disease. And we went on with our campaign against NOMA through collaboration with the Federal Ministry of Health. We have the representative of the Federal Ministry of Health. We have to thank so much for the collaboration. And we went ahead with the online campaign, and we got so many contributions, innovative ways of passing the message, of communicating ways which we can stop and eradicate NOMA finally in Nigeria. Nigeria as a nation, we don't want to be backwards, and as youth, this is our contribution towards that campaign. So with the support from the Federal Ministry of Health, we're able, and other sponsors, we're able to run that campaign. We saw numerous students participate in that challenge. We organized a challenge whereby students were going to communicate in their dialects, their local dialects, to the communities, and we got winners all the way from Lagos, from Enugu, and from Jos. Went ahead to have our academic capacity building summit, which held live in Ife. We saw in attendance the deans of the dental schools, students all over the dental schools in Nigeria, and also members of the Senate and House of Representatives in attendance. The capacity building summit held in Ife, and it was really impactful academically, sports, and socials. Also, as I said earlier, with the coming up of new dental schools, we're able to register new dental students associations. We had that of LASUT registered with us, and JUT, that's Jos University Teaching Hospital. And also we had that of Calabar. Now, moving forward as an association, this is a new year. I remember reaching out to Dr. Josete, and we spoke a lot, and we want to work together. We're reaching out. There's this particular statement or particular saying that it is a child who raises his hand that will get help. So we are reaching out. In the future, we have so many programs. We want to organize a Founders Day celebration. We also have we have the World Oral Health Day coming up, national convention, the regional Day outreach. Of course, we had one last year that was in Borno, where we went to the IDP camps in Borno State. That was last year. It was organized by the students of University of Maiduguri Dental Students Organization. Okay, so we also have the NADS National Games and many other programs, even quiz programs. Now, particularly, I'm here today for the Founders Day. During the course of the seminar today, I was wowed that some of the things we actually planned to come and to discuss here to the house was actually brought forward. And NADS 50 years in existence this year, we want to reach out to all our elders who have gone ahead of us to show us that golden path to success as dental students. We want to celebrate the sacrifices made by our founding fathers of this great association, and it's also aimed at motivating students to appreciate excellence. Then the World Oral Health Day, which already has a theme as "Be Proud of Your Mouth." We also go ahead with our campaign about making people proud of their mouth, because we know generally dentistry is still in Nigeria, it's still in the reception phase. Not everybody in the community out there knows about dentistry. I remember our dean talking about cities having access to so many opportunities. Over there in Ife, to where I come from, and the hinterland, not much of dentistry is really appreciated in the rural areas. And this is where we, the youths, who are closer to the community, coming. So we want to utilize the World Oral Health Day as an avenue to do that. We believe that as a student body, we have a major role to play in educating the world, starting from our home base, about their oral health. Then, just as our parents association, we also have our national convention coming up, which usually wraps the tenure of an executive year. So this year it's going to hold in Obafemi Awolowo University, and numerous activities, of course, will go on. Well, now we are talking about integration. We want to work together with everyone. We've been basing it majorly with private bodies and partners in the production, in the manufacturing industry. We have companies, Unilever and Unilever, Procter & Gamble, all coming forward. But over the years, due to economic downturn, these patrons have kind of declined. So we are also innovating ways to which we can work together and achieve our dreams. So we've reached out to the Association of Private Dental Practitioners of Nigeria. And our integration, we hope, will be of great benefits. As I said earlier, we look forward to one of the key areas we're looking out to achieve is organizing workshops with private dental clinics. I was glad when this was brought up here during the panel session. I was very glad, because we also had it in mind. I, for once, am my final year, and it was when I was in a dental clinic here I was just going around during the holidays. It was there I actually saw live and direct a 3D Mila. So in school, we were taught about it. We only saw pictures, we browsed about it, but we have never seen it physically. Over there in school, if we want to make a crown in teaching hospital, it takes about 2, 3, 4 weeks before we can get a crown. And I saw it live and direct, done within a matter of 3 hours. And I was like, wow, if I had this experience real time when I was learning these things fresh, it would have made a whole lot of difference in my academic. So this is something we are looking forward to working with the Association of Private and Dental Practitioners to organize workshops whereby our students can also benefit real-time skills. Okay, and we also have a mass social media presence. Of course, we are the information age, because we know the impact the youths approved in the country in year 2020 and so on. So we also want to work with our social media presence, which reaches over 4,000 plus followers. We can help promote brands and companies and your products. And we are also open towards our partnership. We look forward to working with you, continual support. We have details displayed on the screen. You can also follow us on our social media handles. Okay, that's NADS_NG on Twitter, on Instagram, and Facebook. Also on this, we have display in the exhibition room. Also, for more details about that, I think for more details, I will call on the, okay. So our social media handles, we have NADS_NG on Facebook, Twitter, and Instagram. So we look forward to working with the Association of Private Dental Practice and making dental education a better thing in Nigeria. Thank you very much.
Thank you so much. It's very nice to see young dentists to be, working to move our profession forward. Thank you so much for that. That was the Nigerian Association of Dental Students. We would like to call on the group called PAGA to give us their presentation now. Are they here? PAGA. Can somebody find out where they are so they can quickly do their presentation and we can move on? Okay. So we're gradually bringing this program to a close. Are we ready? All right, thank you.
Hi, good afternoon, everyone. Yeah, thank you very much for this opportunity for us to be in your presence today. My name is Tayo Agiri Cole, and I have my colleagues here with me. We are from PAGA, and PAGA is a payment platform licensed by Central Bank. And what we do basically is support businesses with solutions, payment solutions. So what we do is that we have produced different payment methods and solutions that help businesses to collect payment with ease. Today, we have over 17 million users on our platform. We have over 30,000 agents across offering agency services to people around, and we have over 10,000 merchants. The merchant that I mean here are, you talk about, dental clinic, hospitals, restaurants, eatery, a lot of them. So what would you may be thinking right now that how does this help my, my business or as a person? What we do is that beyond the POS that you have or the method that you use in collecting payment today, PAGA, in collaboration with Visa International, we've produced this product called Doroki that you see here. And the idea is that beyond the POS that you use at your business today, or the deposit, the transfer method, which is paying directly into your bank account that you have today, you can now accept payment with a single or simple payment solution as this. You can have it on your phone, all right? You can accept payment on your phone or use, POS terminals like this. Now, what this does is that you can, a patient can walk into your location, for example, get to, transfer, and you confirm payment using just this device. They can also use card payment, which is what POSs do today. You can also use USSD payment. You can use QR payment. All right. All of this can be confirmed right on your platform. As you can see on the screen today, we have the bank transfer. The bank feature that you see, this solution or interface you're seeing here, for the front desk person attending to a patient, can insert, put in the amount that the patient wants to pay, then ask, the patient what method they prefer. So if you're selecting a bank transfer, for example, they type in the amount. Let's say, for example, it's 50,000 naira. You put 50,000 naira there, select bank transfer. It generates an account number. Now, this account number is what you give to the patient. They come with their normal bank, all right, which can be GT or any of it. They transfer. When they transfer to this app which we have created, they will be able to confirm payment. The normal way today is that you have to call the accountant or the owner of the business to confirm that a patient has made payment. But here, you have empowered them to confirm that payment right on this device without having to call anybody. So that's one solution we have. The other method is that, which is the having to wait on order to confirm customer transfer or credit alert. You don't have to do that any longer. Cases of intermittent POS downtime. When one is down, you're sure that another is going to be available. So if someone is transferring, for example, please go back to that previous one. Someone has made let's say a patient is not able to transfer. You are sure that you have other options for the patient to use, to make payment. USSD is also an option, which is most banks are promoting USSD payment today. So a patient can come in and say, okay, I can use, for example, GT Bank is star 737, star whatever it is. You just generate the code with the USSD, give it to the patient, they dial it on their phone. The details of the dental clinic is already showing while it is dialed on their phone, and they just need to provide the PIN. All right. Once that is paid, you can also confirm without having to call anybody. This is the simplicity we brought into payment, this environment, and we want to also continue to do that to support businesses. We've been promoting a lot of cashless solutions. Now, in fact, the next step for us as a business now is to now promote cardless solution. A lot of businesses are beginning to think of ways to reduce even card payment. All right. I'm sure for those of us that have done quite a number of transactions out of the country, you'll see cardless, payment beginning to, happen. Can you even take it back to the previous one, please? The previous method, please. Yes, here. The other part is that we've seen cases of people walking to businesses, making payments, and it's fake bank alert, and you will see it. It will really describe exactly what you want to see, and at the end of the day, it's just a fraudulent one. Still go back, please. Yeah, so that is going to take away that issue. You are able to confirm all of these things, and your payment is confirmed. The next is most banks have what they call T+1, meaning that your payment is not credited to you until next day. All right, so that won't happen in this case. All your payments will be confirmed instantly. So if you need your funds for anything, you can move your fund to any bank that you prefer. And the last one is that the bank charges. Most of the solutions that we have out there today, they are not capped. What I mean by cap is that you have some of them, they just charge you maybe 0.5%, for example, and whatever patient are paying, you are sure that that is what you are going to be charged. But here we cap it at 100 naira, meaning that it cannot exceed 100 naira. It can be below, but not more than 100 naira. So this is what we've put together to support businesses. All right, to sign up to be part of this solution that we're bringing forth is very simple. It's free. If you just want to start with your mobile phone, if you have a smartphone, you can download this app on your phone by just going to Play Store, download Doroki right on your phone. Now, your staff on the front desk can download it on their phone. And downloading it doesn't mean that they have access to the money they've collected. They can only use that app to collect payments. They can't move money out of that app. So once they collect payments, as the owner of the business, we set a separate wallet that is linked to their own individual account. So once they collect payments, it drops in your own account, and you have access to the funds, and you're able to move it to any bank in Nigeria as you want. So these are the solution. This is just the process for those that are using mobile phone. It's very simple. Please move forward. This is the method for money transfer. You dial the amount. The first thing is to put in the amount. If it is this much, all right, all you need to do is what? Select money transfer, generate an account number, tell the customer, then tell the customer to give the phone number, the account number to the customer, which is the patient. Tell them to select Pagas on the list of banks. All right. Once they confirm that payment has been made, all the cashier needs to do, or whoever is attending to the patient, is to check payment. And once they check payment, please go down. Now, then once they check payment, it will bring out a box, like a message to say payment has been confirmed or payment not confirmed. They can confirm that right there. Then the next, please. Like I mentioned earlier, we cap it at 100 Naira. You can see the fee there. You can imagine how much this money is. For 0.5%, if other channels are charging you, they collect the actual value, from you. But here, you only pay, 100 Naira. It's capped already. So it can be less, but not more than 100 Naira. All right. So that's for the bank transfer. The next one is, please go down. This is scan to pay, meaning all banks are now promoting QR payments. There's a lot of solution out there now. CBN is promoting, e-wallet, and they are doing a lot around that. So all you need to do is put the amount. The cashier need to just put the amount the patient is paying. Select scan to pay. It will generate this QR code that you're seeing here. Instead of seeing Exponent here, you'll be seeing your business name right there. We're also going to do a physical print that you're going to place at your desk, that when they come, they can scan it. All right, that's a permanent one. So you also see that the fee there is 100 Naira. Regardless of the channel that you're using, you're sure that you're not going to be overcharged. All right. So then the next one, please. Then this is the USSD, which is the third one. With the USSD, you type in the amount as usual. All right, then select USSD. You'll see the list of all banks that we have in Nigeria today. Then you select the preferred choice for the patients. Once you select it, say for example, Access Bank, it will generate a USSD code here. And this is USSD code is what you give to the patient. Patient dial it on their phone. They confirm the name of the clinic and the amount the cashier had, typed in. Once that payment is confirmed, they can check payment as well to confirm that the patient has made payment. This is the solution, that we have built. And please move forward further, please. All right, the fee is still the same, as you can see here. Please move further. Yes. So for USSD, for example, you see cases where patients come and I don't have USSD. We will also give you short code, because technology sometimes it can a particular one that you're used to can fail at any time. So you need to know how to, provide options, for people when they are making payments. USSD, all the banks codes are available. They just need to dial this on their phone and they register their short code in less than 3 minutes. And once that is done, they can make that payment since there is funds in their account. Next, please. All right, so it's very simple. Just have the account, download it on the phone. For a level, we have level 1, 2, 3. Level 1, because of KYC, CBN mandated that we must get the right information. This is not just any business that we're bringing up, but something that is going to support your business. For level 1, you'll be limited to just certain transactions. For level 2, for level 1, for example, you'll not be able to move over 300,000. For level 2, 500. Then level 3, that is where you have unlimited access to your fund, where you're able to move all that money out. And what do you need there? For name, last name, the business name, phone number, email, and you provide proof of business address for the level 3, address and all of the ID cards, and that's all. Account is created, is upgraded to level 3, and that is done. Lastly, all right, like I said, the payment we charge today is 0.5% plus 20 naira plus VAT. All of this is not more than 100 naira. That is, it can be less. It's not more than, that amount. For 2,000 naira above, to any amount it can be. It's not also more than 100 naira. It's less. It can be less, but not more than. So this is the solution we're here to share with you today. We'll be here till the end of the program, and also be here tomorrow. If you find it interesting to adopt for your business, we'll be available to support you. This is the Android POS. All right, it's more like a phone. You can see everything right on the screen. And the second one is the MPOS, just like a calculator. This can be linked to your phone, and you can collect payments, card payments, with ease. So thank you for your time, and thanks for having us here.
Thank you so much for that enlightening presentation from Paga. Thank you so much. They will also be here tomorrow for anyone, and they have a stand at the exhibition hall. So if we have any questions for them, or if you want to explore that as a payment option, please feel free to visit their stand either when we're done today or tomorrow. So thank you so much to everyone who has waited. It has been a long day, but I think it has been a fruitful day, I must say. And so in rounding up our discussions today, we want to thank all our panelists, our stakeholders, particularly those who have stayed till now. Thank you so much, Dr. Eshikena, Professor Sawe, Dr. Karanwi, Professor Da Costa, and Dr. Alunge. Thank you so much for staying to the very end. We want to put forth a couple of recommendations based on the discussions that we've had today. So, action plans. From everything we've heard today, I think we'll all agree that we definitely need to have a platform of all stakeholders that have been duly, please, can we have one house? Thank you. All stakeholders who have been represented here today. And so we are asking for an inauguration of a committee with representatives from different sectors of those. Some are suggesting 2 reps from each one, but we'll leave it to the committee to decide how that will be. And then we're looking at a 1-year working plan for this committee to be able to review the Medical and Dental Council advertising marketing policy, to implement the compulsory S&P for 1 year for all enrollees that we were suggested during the discussions. We're also looking at collaboration with the private sector in teaching and training of dentists. And then the involvement of dentists in the alumni, especially, particularly those in diaspora, in dental training and in management of the dental schools. And then outside posting for final year students at private dental clinics within their localities. This will give the students the opportunity to see what private practice is like, and also will give the private practitioners firsthand influence on the training of these dentists, and also to have policy influencers amongst our elders to be able to help us to influence policy making and collaborate with people in government on behalf of dentists. So we're looking at having nominations for this platform, either here or it can be at a later date, but we would like to have nominations for this group, and then to have a meeting within the next 3 to 6 months, so that by the time we're having our next private practitioners meeting, we'll be able to give a report back from that committee. If there's anything I missed, I would like anyone who wants to help me, but I think that's basically, I hope I captured most of our thoughts on the matter. Okay.
There was also suggestion that the private practice should put together a finishing training program. It has to be there so that they will drive it, and then when you graduate, and you are supposed to be a dentist, you have qualified as a dentist, the private practice can organize their own finishing training and give you a certification. And I will wish that private practitioners should be sensitive about that. When you are taking someone into private practice, you should look whether it has met your minimum standard by way of your finishing training you have done. So gradually, so it's something that I think like in the law school is working directly with Nigerian Bar Association to ensure that lawyers are properly trained before you come and start practicing with them. If you allow them to come for attachment in chambers. So if you organize something like this, people now know that it's not just for you to just graduate and walk into private practice. They also have their own minimum standard they expect from you. Thank you.
Thank you very much for that, Prof. It was actually an omission. So on that note, I think that we can safely close today's meeting. Can we have a vote of thanks from somebody on the association, please? Okay, so we're expecting Dr. Mohammed for the vote of thanks.
Our teachers and our partners in this journey so far, all the representatives, the panelists, on behalf of the executive committee of this association, we'd like to thank you all for coming and taking time out of your busy schedules and very tight activities for coming here today to honor this call to start this journey again to move our profession forward. We pray that we continue to discuss on this issue and we make it a burning issue in our hearts that when we call again, because this is supposed to be the first time, it's supposed to be a continuous process that will continue to discuss this issue and find a way to make all what we have discussed today a reality, and then being able to achieve our set objectives. So on behalf of this executive committee of this association, I'd like to thank you and God bless you, sirs.
Thank you so much for coming. God bless you and see you all tomorrow.